Avoiding overeating before a blood test is one of the most important steps to ensure the results are accurate and truly reflective of your health status. When you consume a heavy meal, especially one rich in fats, sugar, or processed foods, your body immediately begins to process those nutrients, releasing glucose, lipids, and hormones into your bloodstream. These fluctuations directly affect common blood tests such as cholesterol panels, triglyceride levels, and blood sugar measurements. If you eat just before your test, the numbers may appear higher or lower than they actually are, leading your doctor to make decisions based on misleading information. This is especially critical for seniors because at older ages the body's metabolism is slower, insulin sensitivity may be reduced, and digestive processes take longer, which means that food impacts linger in the bloodstream for extended periods. Overeating before testing could cause a blood sugar reading to spike, potentially suggesting diabetes or poor control, even if the person's levels are normally stable when fasting. Similarly, eating a high-fat meal can cause triglycerides and cholesterol levels to surge temporarily, giving the impression of heart risk that might not truly exist. Doctors recommend fasting for a period, usually between 8 and 12 hours, for many common blood tests, particularly lipid profiles and glucose tests, to eliminate these variables and give a clear, accurate picture of health. Fasting simply means refraining from eating or drinking anything other than water, because even small snacks or beverages like juice, tea, or milk can interfere with results. Seniors who are on medications may need to clarify with their doctors whether to take them before the test. But in terms of food, restraint is vital. The reason this step matters so much is that accurate test results form the foundation of diagnosis and treatment. If a doctor believes cholesterol is higher than it actually is, they may prescribe unnecessary medications, while a falsely high glucose reading could lead to anxiety and more invasive follow-up tests. On the other hand, if someone eats something unusual before the test that suppresses certain values, an existing problem might go undetected, delaying critical treatment. Maintaining consistency and following pre-test guidelines helps both the patient and the healthcare provider understand the real state of health. For seniors, there is an added dimension of responsibility because age-related conditions such as heart disease, diabetes, and high blood pressure are monitored closely through routine testing. Even small distortions in lab results can shift treatment plans in ways that impact quality of life. The simple act of avoiding food before the test is a small sacrifice that prevents unnecessary confusion, repeat tests, or incorrect treatments. Water, however, is encouraged because staying hydrated keeps veins plump and easier to access, making the blood draw smoother and less stressful. Preparing properly for a blood test is not just about following rules, but about protecting your own well-being and ensuring the guidance you receive is based on truth rather than distorted numbers created by something as simple as an ill-timed meal. Strenuous exercise before a blood test is one of the most over-the-accurate factors that come to the accuracy, alter the accuracy of results. And seniors need to be particularly mindful of this. While regular physical activity is essential for maintaining cardiovascular health, bone strength and mobility, engaging in intense exercise just before a blood test can lead to temporary changes in the body that skew the outcome. When muscles are pushed hard through heavy lifting, vigorous aerobic activity, or long-duration workouts, they release enzymes such as creatine kinase and lactate dehydrogenase into the bloodstream. These enzymes are natural byproducts of muscle stress and repair, but their elevated presence can be misinterpreted as signs of heart or muscle injury when viewed in the context of a medical test. Exercise also causes shifts in cholesterol and triglyceride levels, which may appear abnormal when measured soon after the activity. For example, vigorous exercise can temporarily lower triglycerides and raise good cholesterol, giving the impression that lipid levels are better than they are in everyday conditions. On the other hand, strenuous activity may also cause an increase in liver enzymes, creatinine, and protein levels, all of which could confuse the interpretation of kidney or liver function. Another effect is seen on blood pressure and heart rate. Exercise naturally elevates both, and while this is healthy in a controlled setting, if the test is conducted shortly afterward, it may exaggerate the baseline numbers, making it seem as though a person has hypertension or unstable cardiovascular responses. For older adults whose bodies take longer to recover from physical exertion, these fluctuations can last longer, sometimes hours after the activity, further complicating the accuracy of test results. This is why most specialists advise avoiding strenuous activity for at least 24 hours before a scheduled blood draw, allowing the body to return to its normal resting state. Light activity, however, is not only acceptable, but encouraged. Seniors benefit greatly from gentle stretching, yoga, slow walking, or balance exercises that keep circulation steady and muscles flexible without creating the biochemical shifts that interfere with blood markers. Such moderate movements also help reduce stiffness and prepare the body for the minor stress of a blood draw, but they do not trigger the enzyme release and metabolic changes that mislead test outcomes. Staying active is central to long-term health, but timing is everything when it comes to medical evaluations. Seniors should think of the day before a blood test as a period of calm preparation rather than intense exertion. By refraining from heavy workouts and focusing instead on hydration, rest, and relaxation, they ensure that the results reflect their true health status. This practice helps doctors make accurate diagnoses, adjust medications properly, and design treatment strategies based on a reliable picture of how the body functions at rest, which is the state most relevant to long-term well-being. Caffeine and alcohol consumption before a blood test can significantly disrupt the accuracy of results, and many seniors are not aware of how even small amounts can alter important health markers. Caffeine found in coffee, tea, chocolate, and certain energy drinks acts as a stimulant that increases heart rate and blood pressure temporarily. This can make it seem as though a person has hypertension or irregular cardiovascular function, when in reality the spike is only a response to caffeine. It also stimulates the release of adrenaline and cortisol, hormones that influence blood sugar levels, sometimes causing them to rise or fluctuate unnaturally. For seniors who are being monitored for diabetes or heart disease, these distortions can be misleading, suggesting instability where none exists. Alcohol, on the other hand, affects the liver and kidneys directly, and since blood tests often measure markers of liver function, alcohol consumption can raise enzyme levels and mask the true picture of organ health. Even a single drink the night before a test can alter results, making it look as though the liver is under stress or damaged when the enzymes are actually responding to the temporary presence of alcohol in the system. Beyond that, alcohol also dehydrates the body, which can thicken the blood and make it more difficult to draw, while also affecting electrolyte balance and kidney function markers. In older adults, where metabolism is slower and the body takes longer to process both caffeine and alcohol, these effects linger longer and show up strongly in test results. This is why many specialists advise seniors to avoid caffeine and alcohol for at least 24 hours before blood tests, with some recommending an even longer window depending on the specific test. Hydration with water is considered the safest option because it ensures veins are easier to access and blood volume is maintained without introducing chemicals that disrupt the balance of the body. Herbal teas that are naturally caffeine-free can also be soothing and hydrating without interfering with lab values. The goal of any blood test is to reflect the body's true baseline condition, not a temporary state influenced by stimulants or depressants. By eliminating caffeine and alcohol beforehand, seniors allow their results to be accurate, leading to correct diagnosis and treatment plans. Otherwise, abnormal readings may lead doctors to order unnecessary follow-up tests, prescribe medications that are not actually needed, or overlook underlying problems masked by these substances. Seniors already face a higher likelihood of chronic conditions such as high blood pressure, diabetes, and liver issues, which means the clarity of test results becomes even more important for guiding their care. Taking the simple step of replacing coffee, tea, or wine with water before a test can save time, money, and stress while ensuring that healthcare professionals have the clearest possible understanding of what is happening inside the body. Certain medications and supplements can interfere with blood test results. And for seniors who often take multiple prescriptions or natural remedies, this factor becomes particularly important. Many common medicines influence how the body processes sugars, fats, and proteins, which can change the readings on blood panels in ways that do not reflect the person's true health condition. For example, corticosteroids and some blood pressure drugs can raise blood sugar levels, making it appear as though someone has diabetes or poor glucose control when the spike is medication-related. On the other hand, diuretics can alter electrolyte levels, creating the impression of imbalances that may not exist under normal conditions. Supplements, often thought of as harmless, can also distort results. High doses of vitamin C, for instance, can affect glucose testing methods and create artificially high or low numbers depending on the type of test used. Biotin, a popular supplement for hair and nails, has been shown to interfere with certain laboratory assays, including thyroid and heart function tests, leading to readings that mislead doctors into thinking something is wrong or that medication adjustments are required. Herbal remedies like ginseng, St. John's wort, or garlic extracts can affect liver enzymes, blood clotting, and other values that are closely monitored in seniors, particularly those with cardiovascular conditions, because older adults often rely on a combination of prescription drugs, over-the-counter medications, and natural supplements. The chances of these interactions showing up in blood work are much higher than in younger populations. The safest approach is not to stop taking medications abruptly, as this can be dangerous, but to consult a doctor beforehand. Physicians can advise which medications or supplements need to be paused temporarily and which must continue regardless of testing, balancing safety with the need for accurate results. Sometimes, doctors may recommend scheduling the test at a specific time of day in relation to medication use, or they may note in the record that certain values could be influenced by ongoing treatment. This way, the results are interpreted with context rather than misread as signs of disease. Seniors who keep a detailed list of all substances they take, including vitamins, minerals, and herbal products, make it easier for healthcare providers to judge whether unusual results may be connected to these items. Preparing for a blood test by reviewing this list with the doctor not only improves accuracy, but also prevents unnecessary worry or repeat testing. Since blood work is often used to adjust dosages of existing medications, avoiding interference ensures that these adjustments are truly aligned with the body's needs. Ignoring this step could lead to prescriptions being changed when they do not need to be, or worse, important conditions being overlooked because supplements masked their presence. Careful preparation guided by professional advice allows blood tests to be reliable indicators of health and supports seniors in managing their conditions safely and effectively. Stress and lack of sleep are often underestimated when preparing for a blood test, yet they can have a powerful influence on the results, particularly for seniors whose bodies are more sensitive to changes in hormone levels and daily routines. When someone is stressed, the body releases cortisol, a hormone that prepares the body to respond to challenges but also raises blood sugar and can alter cholesterol levels. Elevated cortisol just before a blood test may lead to results that suggest poor glucose control or early signs of metabolic issues, even when the underlying problem is not as severe. Lack of sleep has a similar effect because inadequate rest disrupts the balance of hormones that regulate appetite, blood sugar, and blood pressure. Studies have shown that even a single night of poor sleep can cause fasting glucose levels to rise, insulin sensitivity to drop, and blood pressure readings to climb. For seniors who already face increased risk of conditions like diabetes, hypertension, and heart disease, these temporary spikes may lead to unnecessary concern or incorrect medical decisions. Stress can also affect white blood cell counts, making it appear as though the immune system is under strain or fighting an infection, while fatigue may influence kidney function markers, causing results that look abnormal but are only temporary. Because many older adults worry about medical appointments themselves, the anxiety of simply anticipating a blood test can contribute to these changes, creating a cycle where worry leads to stress hormones, which then alter the very results they are concerned about. To counter this, specialists often recommend prioritizing rest and relaxation the night before testing. Seniors can practice simple strategies such as going to bed earlier, creating a calm environment free from loud noise or bright light, and engaging in soothing activities like reading, listening to calm music, or gentle stretching before sleep. Deep breathing exercises and meditation can help lower cortisol levels naturally, giving the body a chance to reset and reflect its true baseline state. Hydration and light meals in the evening also improve the chances of restful sleep, while limiting caffeine late in the day prevents unnecessary stimulation that can interfere with rest. By focusing on calmness and adequate sleep, seniors allow their bodies to return to balance, ensuring that the blood test reflects their real health condition rather than a temporary disruption caused by stress or fatigue. Doctors rely on the stability of these markers to make decisions about treatments, medication adjustments, and long-term care strategies, so accuracy is critical. A single restless night or an anxious mindset might seem small, but the changes they cause can ripple into major shifts in interpretation. For older adults committed to maintaining health, investing in rest and managing stress is not only beneficial for the test itself, but also for everyday energy, mood, and resilience.